Hi, I'm Kelly Dyer Fry, editor of The Oklahoman. I'm here today on the Chesapeake campus with Dr. Jeff Borenstein. He is here at the invitation of Chesapeake to talk to their employees and also to visit tonight with some people from the medical community about ways you can spot addiction, depression, ways you can spot anxiety, and how to deal with that. So welcome, Jeff, to Oklahoma City.
I'm happy to be here. Thank you.
You've met with the employees today at Chesapeake. What did you tell them, or what were your main areas of focus?
First and foremost, don't suffer in silence. Too many people, because there's a stigma, there's embarrassment, may have depression, anxiety, chemical dependency, post-traumatic stress, other conditions, and they suffer in silence. In fact, unfortunately, the majority of people who have a psychiatric illness, including chemical dependency in our country, don't get treatment, which is an extraordinary fact when you step back and think about it, especially because treatment is so effective. And with help, people are able to get better. So that's the first message.
And when people reach out, I mean, we're inundated all the time now with commercials on television talking about what's the word I'm looking for? Antidepressant medicine, talking about antidepressant medications. Is that one piece of the puzzle? Is that the answer? I mean, what do you tell patients when they go to maybe their medical practitioner or just their general doctor and say, I think I need an antidepressant? What do you say to them?
First and foremost, it's important to make a diagnosis. So if someone's feeling depressed or anxious, they certainly should tell their primary care doctor about it, and that physician needs to help make a diagnosis. Either they themselves can do that by asking a number of questions, taking a careful history, or they could refer them to a psychiatrist, a specialist, to make that diagnosis and begin treatment. If somebody does have a diagnosis of depression, treatment can include talk therapy, medication, diet, exercise, sleep habits. These are all, you have to treat the whole person, not just one part of the person. And an important message is that sometimes depression just comes for no apparent reason. There's no clear-cut stress that it happened. Sometimes it comes because of some external stress in a person's life. In either case, it needs treatment, and the person should seek that care.
So is that often combined? Does that mean medication and talk therapy?
Often medication and talk therapy is the treatment of choice. There are some people in whom talk therapy alone can do it. There are some people in whom medication alone can do it. But often, if a relative of mine had a depression, my off-the-cuff answer, without having details about it, would be that they should have talk therapy and, if need be, medication.
Let's touch a little bit about anxiety. Anxiety drugs a lot of them are pretty addictive, are they not? Like Xanax and things like that?
The antidepressant medications are not addictive.
Right.
But they need to be used very carefully, monitored by a physician. Mm-hmm. The classification of anti-anxiety medications called benzodiazepines are potentially addictive. So what does this mean? Well, first of all, if somebody has a history of chemical dependency, for the most part, and there's always an exception to a rule, but for the most part, those are medicines that they should not take. They can consider themselves to be allergic to those medicines because they are addicting. For people who don't have a history of chemical dependency, there are times that those types of medicines can be used for a period of time under very careful monitoring by a physician. And they can help with anxiety in the short term, but over the long haul, talk therapy, sometimes some of the antidepressants or other medications can be useful for the anxiety so that the person doesn't have to take a potentially addicting substance over the long haul.
Let's talk a little bit about addiction. Let's move on to that. Addiction is defined as a disease, yet it's so misunderstood still by our society. Why do you think that is, and what can be done to educate people that addiction is a disease that doesn't strike every person that uses substances, but it does affect some?
It's a very important question. Addiction is a disease. We now know that that's medical science is clear that it's a disease. And similar to other diseases, it has a set of symptoms. If untreated, it has a course of illness, again, like other diseases. It has a component to it that may be inherited or genetic, and it has a component to it that may be environmental. And the combination of the two, someone can have a slight genetic risk, but have significant environmental trauma or other factors that throws them into having the diagnosis of chemical dependency, or someone could have a heavier genetic risk and less will throw them into it. And that's important because people with a family history of chemical dependency need to be extra careful about the risk factor. But our society puts a stigma on chemical dependency and on psychiatric illness. And it's not unusual for people to have both, so they have a double stigma.
Right, and it's not a moral failing, it's a medical.
Saying that addiction is a moral failing would be similar to saying that epilepsy is a moral failing. Now, years ago, people thought that, and people were burned at the stake because they had epilepsy, because it was a moral failing. But we know epilepsy isn't. Nobody questions that at this point. I think we've come a long way for some psychiatric conditions that people realize it's not a moral weakness or character weakness. And I think to a large degree we've moved forward with chemical dependency, but there still is that stigma which gets in the way of people getting treatment.
You said a word a little bit ago, an allergy, almost like an allergy to some of these medications. If it's like an allergy, why can't we get an allergy shot? Why isn't there an immunization against addiction or stronger medication? I don't understand, why is it just 12-step recovery programs? That's about it.
It's a great question. And I think at some point down the road, people said, why don't we have a shot to avoid polio? And we do. And not long ago when I was in medical school, if somebody had HIV, AIDS, they would be dead soon. And now people are able to live long lives with HIV, being HIV positive. People are able to have cancer and get cured from cancer. We're not there yet for chemical dependency, but a lot of research is being done. And I think down the road we will have more treatment, medications, other treatment that can make a difference. But the good news is, even currently, anybody can get into recovery. I've seen people who were in the lowest of lows who were able to move forward and get into recovery.
One challenge I have with things like Alcoholics Anonymous, because I've shared my personal story with my son is in recovery. Why is it Alcoholics Anonymous? It seems like they put shame on themselves by their very name.
That's a very good question. Probably I would defer to members of Alcohol Anonymous to answer that question. But you have to remember, when it first came into being, there was a lot of stigma. And it was a big step forward for them to come together and support each other and be helpful to each other. So maybe down the road it will change in terms of Anonymous. But I think that the community of people in recovery is very supportive to each other and very open to bringing in people and engaging to help new people get into recovery. So it's called Anonymous, but the community of recovery is very open and supportive.
Tonight, Jeff, you are going to be talking with physicians. What is your message going to be to them?
My message to physicians is that they're the first line of defense. Primary care doctors are who see patients, and they need to be careful about screening for depression, anxiety, chemical dependency when they see patients. And physicians are in a rush these days due to how hard it is to practice medicine. We're all on a time constraint. We need to be able to take the time to speak to our patients and ask them what's going on in their life. How are they doing? We need to, in the olden days, you'd have a physician from birth until death. We need to be able to move back toward that so that our physicians know us. And if they see a change, if they see that we're under a life stress, they see that we appear depressed, that they ask some more questions. And there are actual tools that they can do to ask questions, diagnostic tools that can help them in seeing whether or not someone may have a depression. And then if they're treating the depression, could help monitor the progress. So my message to the physicians are, this is an important issue, and we need to be careful and make the diagnosis and then give appropriate treatment to people.
Well, Jeff, thank you for coming to Oklahoma City and sharing your wisdom with us. We'll share those links on our website that Dr. Jeff mentioned. And you can also watch Dr. Jeff on PBS on
Healthy Minds. And the episodes, all the episodes that have aired are available online at www.wliw.org/healthyminds. And I'm sure that's going to be written on the bottom third.
We'll link to that on our website as well. Thank you very much.